my name's Charlotte. I'm one of the physios in the women's health team here at Milton Keynes University Hospital. Today we are just talking about pelvic girdle pain and lower back pain that lots of women may experience during pregnancy. Within our team there are lots of specialist physios who are able to try and treat your symptoms, and we can look at trying to help you through your stages of pregnancy. So another really common issue that ladies have, and this comes up time and time again, is getting into and out of bed and then turning over in bed. And it's like, oh, I've woken up again because I was in pain, I was in discomfort, turning over in bed. And then it takes me a while to get back to sleep. So trying to just look at following all the same type of tips. We're trying to keep the pelvis in symmetry, making sure that we're using our muscles to help us during these movements should make life a little bit easier. So when we're getting into bed, what we want to avoid is that separation of that leg again, okay? And what we want to do is think about sitting a little bit further down the bed than maybe you would be used to. And then so that when you go down, your head is actually just going to hit directly onto the pillow. So you're going to use your hands, okay, coming down onto your side, onto your elbow, using your other hand to support you, and then bringing those legs up. If you're finding your legs are becoming really heavy and you've got someone that can help, can you ask them to help lift those legs into bed? Okay. Then once you're here, you can come down onto your side and look, great, you're already in one position. Okay. You may find that that's great and you can sleep there. Okay. When you then need to turn in bed, it's thinking about keeping that pelvis in that neutral position, thinking about rolling over nice and slowly so that we're not going to be doing anything that's going to irritate your pain. What you want to look at doing is again using your hands to help, trying to do it in slow stage movements. So you might start to bring your shoulder round, so coming underneath. Other hand may come round to the side already. Activate, squeeze your bottom muscles, squeeze your pelvic floor, activate your pelvic floor, and keep your knees together. And you're going to come round, keeping those legs together. Again, using your hands to support you and bring you round onto the other side. If you find that way is uncomfortable, coming back round, it's actually to go underneath. So some women find that they struggle to turn over on their backs, but what they do find a little bit easier is coming onto their hands and knees. So like we did earlier, it's coming round, keeping those knees together, using your bottom muscles, using your pelvic floor, coming round here, coming round with your hands, and lowering yourself back onto the other side. So the other area of posture that we need to think about is actually posture when you're lying down. When you're lying down in bed of an evening, we need to think about the way that we are lying. So starting off at the top, so with your head, making sure that the pillows are nicely supporting your head and your neck, making sure that you haven't got so many that you're starting to come up here, which puts a little bit more pressure through your neck and can become quite uncomfortable, or that there aren't enough pillows that your head is flopping downwards. So make sure you've got just enough pillows that you're feeling nice and comfortable there. Also then thinking about what's coming down at the kind of around your bump area. We want to support your bump and your lower spine. So what can be really helpful is thinking about getting a rolled up towel or a small cushion, and then just supporting that underneath your bump, so we're taking the weight of bumps. That's not drawing you forwards and down. You can get pregnancy pillows, but they aren't essential. You can just use things like rolled up towels, a small cushion to support you. The other area that can be quite uncomfortable is down through the hips and through the legs. So again, using another pillow just to support between your legs, whether you like it down below, whether you like it a little bit further up, and then that's going to support and keep that pelvis in a nice neutral position. And that way you should be nicely supported, so all of your spine is well supported and your pelvis is in that neutral position. And hopefully you can get a good night's sleep. In regards to lying in bed and when you're sleeping, it's kind of, you can sleep on either side. You can sleep on your left side, you can sleep on your right side. Doesn't really matter. Lots of people get fixated on this left side lying, but that's really more for when you're in labour, or if you're starting to feel a little bit dizzy, feeling not great, go and have a lie down on your left side and just see if that helps things. What we do want to avoid is lying on your back, purely to do with that blood flow.